now the city of New York has been walloped with one of the highest death rates from the coronavirus pandemic. The neighboring state of Pennsylvania has also experienced a beating. The state has so far had a total death count of 2,444 patients, with Philadelphia County recording one of the highest death rates. The state's Secretary of Health has, however, not released any data on rates of recovery, suggesting that such data will be available at some point in the future. The city of Philadelphia is also home to a majority black population, which has been hit particularly hard. The current poverty rate in the city is 24.5%, with grim healthcare outcomes for the poor and the underserved. This week I had the chance to sit down with Dr. Terry Christopher, a third-year general surgical resident at the Mercy Catholic Medical Center. Dr. Christopher is a first-generation Grenadian immigrant who has had to make the transition from conducting regular surgical procedures to responding to the surge of COVID patients at his hospital.
As it relates to the fact that, we have been here before, but not in our lifetimes. No one in our generation has really seen a pandemic do such acute harm in such a rapid period of time. But there are lessons to be learned from history, and this has happened before. And we're just seeing what this can do. In terms of a transition as a surgical resident, things have changed in the last couple of weeks for us, the last couple of months actually. The Surgeon General has suggested, or pretty much at this point, it's required that we cancel all non-emergent surgeries. So all elective cases have been put on the back burner for now while we deal with the surge of patients needing acute care due to COVID.
Mm-hmm.
It has certainly been a transition. There are people who have been waiting for surgeries to be performed, and to them, their life is in limbo. But for us here, there has been quite a surge, in patients requiring ventilation, requiring a lot of support because of COVID, and so it pretty much has changed our practice, in the last few weeks, I would say.
Christopher says that while the ventilator shortage has been a significant issue in the city of New York, they have been managing expectations around ventilator shortages in his region.
So generally, the Philadelphia area, in terms of the entire state of Pennsylvania, this has been a hotspot. And despite that, the hospitals in Philadelphia have not really gotten to the point of running out of ventilators. In fact, Temple University opened up their athletic center, with a capacity of about 180 ventilators. And they're yet to get to their capacity. I think the Philadelphia area has been handling the flux well. Certainly resources are strained everywhere, but I can't say that in Philadelphia the situation is as dire as in New York, per se. In terms of, so I am in the Delaware County area, which is one of the top 3 or 4 most prevalent cases, and where we are, we certainly get very close to capacity, but there's a high turnover rate, and so thankfully we haven't gotten there as yet.
Many have been discounting the severity and intensity of this virus. Christopher, however, prefers to frame the virus as both a personal responsibility and public health issue.
There are certainly people out there, and the data that's been coming in has been showing that people who are young and they don't have pre-existing issues, they tend to be the ones who are asymptomatic. This is a public health issue, though, and as much as a person can believe in their immune system, or as much as a person's immune system can deliver for them, the truth is that there's a lot of evidence out there that people can be spreading this without having symptoms themselves. And at this point, we have to think about the people around us who are not so robust, who are not so fortunate to not have pre-existing issues. And so we have to think about each other as a community. At the very beginning of this, even I as a physician, I had things wrong. I really thought that young people, and by young I mean under 60, are going to be, pretty clear of all of the complications. But we're seeing more and more people in their 40s and 50s who may just have one thing, whether it's COPD or heart disease. And these are people who are still productive in our society, and we should have an interest in protecting them and protecting each other. And so that's what I would say to the people who feel that they are so robust and they're itching to come out. It is a sacrifice, but it's a sacrifice that is worth it.
Mm-hmm. What lessons have you learned from this experience that perhaps that medical school might not have prepared you for?
Improvisation. As a surgical resident, I'm still in training. I'm still learning my craft. And so getting up and going to work every day, the goal is to learn. Over the last 2 months, I'm learning differently. I'm learning how to be more resourceful. I'm also learning teamwork. We now, as a surgical resident, I have to partner up with a lot of the internal medicine residents who are truly on the front lines, and they would need my help for placing a central line or something that a COVID patient would need. It's all about teamwork. There's no one specialty that is in charge of taking care of a COVID patient. It is complete coordination. So as a resident, I think those are very, very valuable lessons to learn.
Although the death toll has reached an all-time high in Pennsylvania, they have been able to see a lower rate of spread in its mostly densely populated city center. Reporting from Washington, D.C., this is Kellen Bubb.